Okay, so welcome. My name is Amy Herrera. I am sharing my screen right now so you can see I am with GMaP Region 3, and I'm here with my co-host, Emily Kay from Region 6. And we're going to get started by just telling you a little bit about GMaP and who we are and why we're hosting this webinar. So GMaP is, actually, I'm going to switch back here real quick. The Geographic Management of Cancer Health Disparities Program. So that's what our acronym stands for. It's kind of strange that it doesn't include the cancer health disparities part, because that's like the major point of GMaP, but it's quick and easy to remember. So we're part of the National Institute of Health, National Cancer Institute Center to Reduce Cancer Health Disparities, so CRCHD. We're a program through that piece of the NCI. So GMaP is comprised of the 7 regions you see in this map here. Each one you'll see a white tick mark. That's where our regional hub is. So for Region 3, we're here in Albuquerque, New Mexico, and Emily's Region 6 is in Salt Lake City, Utah. So it's the entire continental US, and then Alaska, Hawaii, Guam, American Samoa, and also Puerto Rico. So GMaP is to support and manage cancer health disparities research, training, and outreach. So that's what we really do as support.
Yeah. So sorry to interrupt. Yeah, as Amy was saying, GMaP supports cancer health disparities research as well as recruitment and career development of underrepresented cancer researchers. As a program, it provides networking, professional training, kind of like what we're offering today, as well as communication and information dissemination from regional to national level. And then GMaP partners with, as Amy was also saying, the National Cancer Institute Center to Reduce Cancer Health Disparities in support of the CURE program. And CURE, I think that's on the next slide. CURE offers unique training and career development opportunities to enhance and increase diversity in the cancer research workforce. The program, the CURE program, identifies promising candidates from high school through junior investigator levels and provides them with a continuum of competitive funding opportunities. And you can kind of see all of the different funding opportunities available. If anyone has any questions about what funding mechanisms fall under CURE, or questions they want to reach out to Amy or I, feel free to.
So our regions offer a lot of the same resources, but they are a little bit different. So for Region 3, these are the main ones that we provide. We have the grant writing resources. So we do mock reviews and provide training like this webinar. We have a monthly e-newsletter that goes out. It's going to include all kinds of good information like job openings, trainings, and workshops like this one, funding opportunities, conferences, and any other important information that's out there about cancer health disparities. We also have a travel scholarship program, which is for US citizens and permanent green card holders. That is, you can get up to $2,000 to support to go to a conference and take a poster or do a presentation. And that can cover travel expenses as well as the conference registration fees. And the application is through our website. It's very short and simple. And it is a little bit of a competitive process. It does go through a committee, and you can use that all year round until our funds run out. We have mentorship opportunities. We also have communications through our website. For example, we feature a scholar, a little 1-minute video about what one of our members is doing. So it gives you kind of an idea what they got going on. We have cancer and cancer health disparities, that training community network. So our experts like Dr. Myaskovsky that's going to be talking to us today And then, of course, we do encourage the attainment of those NCI funding mechanisms like the F, K, and R awards. I'll let Emily talk about Region 6.
Yeah, perfect. So our region offers much the same programming as you'd find in Region 3. And I've listed it all there. If you have any questions, again, feel free to reach out to me. We are currently really promoting our travel awards. So if you are attending a conference in the fall or the spring and you're part of my region, please definitely consider applying for those. You can contact me for more information. The other thing that I wanted to take a minute to promote is our mentor-mentee training, which is coming up in September, so starting soon. And that is a 5-week series that provides a framework for enhancing mentorship and improving mentor-mentee relationships. So if you're interested in that, reach out. It's completely free and it's virtual. So anyone from any of the regions can participate in that.
So finally, I just want to put a plug in Regions 3 and 6. We are collaborating on an in-person technical training summit in the spring of 2023. So it's gonna be from March 8 to 10. And this is going to be all kinds of awesome opportunities to learn about those K, F, and early R-Series awards in person and collaborate with researchers and people from all around the regions. We're going to have keynote speakers on things like workforce diversity, mentorship, and of course that cancer-focused health disparities. And I have listed there some of the learning sessions that are going to be going on. We're really going to be breaking down the grant writing process into sessions to talk about each of those specifically. So here are our contacts. I don't want to take up any more time, but that is GMaP, kind of who we are and what we do. Okay, I want to now introduce our speaker. Dr. Myaskovsky is a tenured professor with her PhD in social psychology from the University of Pittsburgh and is the director of the Center for Healthcare Equity in Kidney Disease in the Department of Internal Medicine at the University of New Mexico Health Sciences Center. She also completed a postdoctoral fellowship in clinical epidemiology at the University of Pittsburgh. Dr. Myaskovsky has more than 20 years of research, education, mentoring, and funding experience. With multidisciplinary training in social psychology and clinical epidemiology, she focuses her research on the social determinants of health by using a multi-method and multidisciplinary approach to identify and understand disparities in healthcare processes and outcomes, and to develop interventions to reduce health disparities in people with disabilities and chronic disease. She's taught courses on healthcare disparities, research design, medical writing, and grant writing, and has mentored junior faculty, fellows, and graduate students. So I will now hand it over to our speaker, Dr. Myaskovsky.
Thanks so much, Amy and Emily, and I appreciate that overview, and I'm going to encourage my mentees to take advantage of those opportunities, and I think that's wonderful that you guys are able to offer those kinds of things. Those are very few and far between, and I would say that those kinds of opportunities really help build up the background that folks will need for K and R writing. So I encourage all of you who are on the call today to please pursue those things, because those are great networking opportunities, and those are really great things to add to your CV, that you are a recipient of these kinds of even small competitive awards. So so that's a plug for those things, and I will be sure to make sure that my mentees apply for them as well. In the meantime, what I was going to ask that we do before I start talking about the R-Series overview is I'm going to ask you to go a little bit beyond your comfort zone, turn on your cameras, and we're going to do a little intro first, if we can go around the Zoom screen, and I'm just going to point to people as I see them and ask you to turn on your camera, unmute your microphone, and introduce yourself, like where you're coming from, what stage you are in your career. So that gives me a little better sense of who you are, where you're coming from. And it also gives us, I can maybe do some more personalized instruction as I go with my slides. So thank you. I see everyone turning on their cameras already. That's wonderful, because then I see, as a social psychologist, I really need to see human response and reaction. And so it's really nice to see that instead of like little squares. So I'm just going to kind of point out 3 people that I see right now, and then I'll just ask for 3 more. And if you could just, like I said, introduce yourself and where you're from and your kind of stage of your career, that would be great. So the first 3 I see in my screen are Jason, Juyan, and Gabriel.
Hey, thanks for the talk today. I'm Jason Semprini. I'm at the University of Iowa, and I'm a research fellow in the Department of Health Management and Policy.
Hi, I'm Juyan Huang, and I'm an associate professor at the University of Oklahoma Health Science Center. I did my postdoc at the NCI, and I'm doing my research on the cancer for my population. So yeah, thank you.
Good morning, everyone, or hi. No, that's not good morning anymore. So good afternoon. I'm Gabe from the University of Texas at El Paso. I'm an assistant professor here at the Public Health Sciences Department. My major responsibility is environmental and occupational health. And on the good note, I just submitted my tenure package yesterday. Yay! Let's see what here happens. And I was listening to Larissa, and we need to talk because I'm interested in kidney cancer in workers exposed to extreme heat and dust. So those are my main issues right now. Thank you. Nice to meet everyone.
Thank you. Next, I see FR Munoz, Megan, and someone with iPhone. So I'm going to ask those folks to introduce themselves next.
Hello, everyone. My name is Frank. I'm a postdoc fellow at the City of Hope in clinical cancer genetics. And I have a KO1 set up to be reviewed in October. And so I'm helping out with numerous projects related to genetic testing behavior among English, Spanish, and Mandarin speakers. And my KO1 will focus on Spanish speakers and genetic testing. Thank you.
Hello, my name is Megan Mullins. I'm an assistant professor at UT Southwestern Medical Center in Dallas. And my research is focused on cancer care delivery for people with advanced cancer.
Hi, I think I'm iPhone. Sorry, I forgot to sign into my account. My name is Shannon Segan. I'm actually a postdoctoral fellow at the University of Minnesota in Minneapolis. And I'm a cancer epidemiologist that focuses on environmental exposures like tobacco and trace and toxic metals and genetic risk factors in cancer.
Thank you. Next, I see Helen, Ugana, and N. And I hope I pronounced everyone correctly. Sorry.
Hello, I'm Helen Stankiewicz. I'm at the University of Washington in Seattle. I'm an infectious diseases physician by training, and my research centers on HPV-related anal cancer and vulvar cancer prevention.
Hi, everybody. My name is Agrona. I am a postdoctoral fellow at the University of Southern California, and I'm a cancer epidemiologist. My work focuses on air pollution and endocrine disrupting chemicals in breast cancer and colorectal cancer.
Hey, N, we can't hear you. We see that you're trying to talk, but we can't hear what you're saying. You have an audio issue. Okay, thanks. And then I see Moafa, Maja, and I think that would be everyone.
Hello, everyone. My name is Mofak Adam. I'm from San Diego State University. I'm a postdoc. I just moved to the United States a year ago, which feels amazing. I'm from Sudan. I did my bachelor and my master degree in India, and I did my PhD in medical oncology in Malaysia. Right now, I'm working with IDH1 mutation and how it's driving brain cancer. Previously, I worked with mycotoxins and their involvement in increasing the risk of breast cancer.
Hi all, my name is Maya Pedersen. I am a postdoctoral scholar at the Stanford Prevention Research Center, and my research focuses on lifestyle behaviors and cancer prevention in community settings, particularly among rural and older adults.
Well, thanks everyone. And if you get a chance to maybe, since we don't know where you're from, put your information in the chat so that we can get to know you as well. And I have to say, this is the most diverse group in terms of background and stage of career that I've interacted with and presented to. So I hope I capture all of your needs, but feel free to ask me questions at the end, or feel free to email me afterwards. I'm going to share my slides and hope this works. And then I will not be seeing folks' faces or the chat. And so I'm going to be counting on Emily and Amy just to let me know if someone has a question, but also please feel free to just ask me your question or just to speak up, because I'm happy.
Can you hear me now?
Oh, and yes, we can hear you now.
Yeah. It seems, is there echo?
No, we can hear you.
Okay, great. So I'm En Cheng. I'm from Casa Permanente Vivarium Research in Oakland, California. I'm doing my postdoc here. My primary interest is in cancer epidemiology. I'm doing research in energy balance, body composition, inflammation in colorectal cancer and breast cancer.
Dr. Myaskovsky, I think
Okay.
we have a couple more that we let in while people were introducing.
Okay.
We have Anil Wally and Irene Tammy, who we haven't heard from yet.
Sorry about that. Yes, please introduce yourselves.
Hello, everyone. So nice to see you. First and foremost, I would like to thank Amy and Emily, our GMaP Region 3 and 6, for spearheading this event. And thanks to you, Dr. Larissa Myaskovsky. It's such a delight to see all of you. And this is the intent and purpose of running this GMaP initiative from NCI. I'm the program director who manages this GMaP from NCI. So nice to meet all of you. Please continue.
Hi, my name is Irene Tami. I apologize, I cannot work my webcam. It's just the front camera, not the back one. But anyways, I'm an assistant professor at the University of Texas Health Science Center at Houston. I'm a cancer behavioral epidemiologist focusing on tobacco prevention and control among populations in vulnerable settings.
Great, thank you so much. So I'm gonna try to share screen again and again. Please feel free to ask questions. I don't mind people speaking up, especially because I won't see the chat. And if you just have a question or just say, I have a question, I'm happy to pause and discuss it, because I think the questions that one person has are really questions that other folks have. They just haven't had a chance to think of it or ask it yet. So no worries there. And I'm gonna start now. Am I sharing? You should see each other. And hopefully now you're seeing my screen.
Yeah, that looks good.
Okay, excellent. So By doing this NIH R-Series overview, I want to give you, by way of background, one of the things that I like to reference is not only my own experience as someone who submits Rs and has continuous R funding, but I've served on several grant review panels. And as such, I like to give people the perspective both as an applicant who submitted, but also as a reviewer, because ultimately your grants that you submit are going to be reviewed. And I can tell you my own experience and my own kind of process as a reviewer, but also what I've seen other reviewers do. And so hopefully those experiences can help inform your learning and your understanding, and certainly what I'm presenting to you today. Okay. Let's see about advancing slides. There we go. So I'll talk about, I'm going to give you an overall R award overview, some little background information. Then I'll talk about the different components of the research plan. I'll try to spend some time on BioSketch, the environment, the appendices, and letters of support. And I'll also hit on administrative steps and hope to leave time for Q&A. I'm so glad to see that we have more detailed seminars planned for the spring, because I'm really only going to give an overview and touch on some of these things, but I've given talks on each one in depth. So this is really going to be a surface overview, but I'm happy to answer questions about specific questions you might have. So just in terms of an overall overview, the pattern of NIH research training career development timetable. This is a slide that I borrowed from NIH presentations. And I think that it's important to see this and think about where you are in your career and see which kinds of grants you qualify for. Right now, we're talking about the R series, and that's things that you can submit in your early, mid, and senior career. All of these R03, R01, and R21s are things you can do early, mid, and senior. But there's other grants that you can only qualify for in your, either in your pre-doctoral career or early in your postdoctoral career and early faculty, that I would encourage you to consider if you still qualify, because once you're the PI of an R01, you no longer qualify for these early career grants, a lot of them. And so you can be a co-I, but if you're a PI on an R01, it's awesome. You're there, you've made it, so you're fine. But if you have the time and the opportunity, I would actually strongly encourage you to think of a K first before an R, because it gives you 5 years of protected time that once you have your R, you don't have anymore. And so it's just something to think about. As I was hearing some of you say you're a postdoctoral fellow or early career, you're probably, or assistant professor, you're probably going to still be in that timing where you can qualify for a K. And I would strongly urge you to do that. Reach out to your program officer, see what kind of Ks are available, and think about those before you go into the R world. Because again, once you're there, you're no longer considered a new investigator and you don't qualify for Ks. But of course, you're successful independently as an R recipient, so it's all good. So these are the main different types of R awards. There's the R01, that's like, people think of it as the gold standard, right? It's the research project grant program. It's the investigator initiated independent ones. There's small grant programs of the R03, the area or academic research enhancement awards that are the R15. The R21s, you think of those as exploratory developmental research grant awards. Those are 2 to 3 years usually. They're pilot. They're typically thought of as larger scale pilot projects that one uses to secure some pilot data in preparation for an R01. And then there's the R34, that's the NIH Clinical Trial Planning Grant Program. Now, I went to the NIH website to look at the history of funding, and you could do this too, which is why I gave you that website at the bottom of this slide. I wanted to kind of place what the history of funding is and what the success rate is by year. This is for new submissions, and I just pulled the data and graphed it for you so that you know that the success rate is really challenging, right? So for RO3s, I'd say it's the highest at 20% in 2012, but that's gone down through 2021. And all the other funding sources, specifically for NCI awards, which is what probably your primary target is for all of you, those are in the 10 to 13 range, and some lower in the single digits. So the success rate is really challenging. And I don't give you these numbers to discourage you. I just give you these numbers to kind of place us in a sense of reality where this is a lot of hard work. It's challenging, it's frustrating, and new submissions typically don't get funded on the first go around. They need a revise and resubmit, and it's nothing against you or your intelligence or your character or anything else if you don't get it funded, especially on the first try. So do keep that in mind. A lot of incredibly smart and talented individuals and research teams do not get funded, and they have to try again, but that commitment is worth it. And frankly, I'd say the peer review is really worth it, because I've only ever seen grants improve in their rigor, their discipline, and their methodology when they're revised and resubmitted, because the peer review process is designed to do that. It's designed to use NIH dollars, right? Grant, which is federal funding based on taxpayer investment. So what can, my Grandma Donia's money help you do? We want to make sure as peer reviewers that you're doing good work on behalf of folks in our country. And that way peer review makes sure it's the rigorous and the best methods that you can use. And so while these numbers are kind of challenging and kind of scary to look at, I think ultimately what it does is help us get to better science. So in terms of the picture or the scale of R01 funding, a lot of you still qualify as new or early stage investigators. And I put this slide in to make sure you think about this opportunity. A new investigator is an applicant who has not previously competed successfully as PD or PI for a significant NIH independent research award. And that's why I gave a hint of that about the K versus the R stream. So as a new investigator, you get a little bit more favorable of a pay line, as well as an early stage investigator. That's any new investigator who is within 10 years of the terminal doctoral degree or end of formal clinical training, like a residency or fellowship. So if you're within 10 years of a postdoc, you qualify as an early stage investigator. And again, you get a little bit of a boost and you get a more favorable pay line. And so again, as I say here in the final bullet, the pay lines are low, but they're more generous when you're new or early stage investigator. And that's something that if you've decided K is not the path for you, I encourage you to apply for R21 and R01 and R3 funding sooner than later, because those first 10 years really matter. And even if you're more than 10 years out, you may not qualify as an early stage investigator, but you can still qualify as a new investigator if you haven't been a PD or PI of a previous grant. So new investigator is regardless of how many years post training, and early stage investigator requires that you're within 10 years of your terminal degree or formal training. So some other background, when you prepare to apply, I like to think of this, even for myself, having done grants quite a bit and having submitted way more grants than I've had funded. I like to give myself almost a 1-year timeline as I prepare to apply for a grant, because of these steps that I describe here. First of all, you want to confirm the appropriate type of R and the institute. So looking at your FOA or your RFA, making sure that your research question applies to the FOAs that you come across. You want to determine if the desired institute offers that type of R. So, like you saw in my early slides, R34 is available it exists, but NCI doesn't seem to fund those. In fact, in the last 10 years that I looked back, they've been actually zero funded R34. So keep that in mind, that what you think before you get too far down in planning and your aims and designing your study, make sure that the Institute is funding that kind of application, and make sure that what you want to do is in line with what that Institute is interested in. And one way to do that is identifying the Institute program officer and contacting them sooner rather than later. I think this is a really important step. I think it's very scary to contact NIH. They're very nice people, but the thought, it's kind of intimidating. And I can tell you, when I was working on my first grant submission, I was shaking. And I don't know if my program officer heard it in my voice, but I was shaking on the phone. I had my questions prepared. I had my aims prepared, but I was very nervous on that first call those many years ago. And I think that's a normal human response. It's an intimidating big agency, but it's actually better to do sooner than later, because developing a draft of your aims, it doesn't have to be a perfect draft. It doesn't have to be a draft that's been reviewed by all of your co-investigator, but a good draft where you can convey the goals of your project to the program officer that they can read before the call helps them to help you determine if their institute or their specific division is going to be interested in funding your project. And if not, often what they'll do is say, yeah, this doesn't really align with our objectives and goals, but I know this other program officer or this other institute that I think would really be interested in hearing about that. Here's their email address. Why don't you contact them? And so that's a really important call to make sooner than later. I can't tell you how many times that I was right about this, that I didn't want to be, when someone, 6 months after the fact that I told them to do this, has already written their aims and developed their program, only to find out that, yeah, their institute is not really interested in that. And then they have to go back to the drawing board. And so please do contact your program officer sooner than later. Don't wait till your aims are perfect. Just make that initial call, and maybe work with your mentors or your co-investigators who have a little bit more experience. If you need some coaching, if you need some kind of prep work in preparation for that call, do take the time to do that, because that will help you quite a bit in having that call and talking to your program officer. Again, see what your target institute is funding, or search by FOAs. Again, and like I mentioned, prep with your colleagues or mentors for the call. And another thing that you can do that I think is really important is to prep by reading other people's grants. Having some templates or examples, even if it's a completely different area than yours, even if it's like, for instance, my stuff on kidney disease or kidney transplantation, that right now it doesn't have anything to do with cancer, but maybe after this call, we'll be looking at kidney cancer soon. But I think the idea is, look at how they format things, look at how they word things, look at how they use figures and tables to make points about their design, their theoretical model, and use those successfully achieved R's as good templates or examples of how to structure your grant. Because I can tell you that a lot of these things over time can kind of be formulaic. It doesn't mean that there's no room for creativity. It doesn't mean that there isn't room for your innovations and ideas, of course, because they want your innovations. But some things, when it comes to structure and writing style, those are pretty standard. And folks that have experience and have had successful R01s one after the other have it down. And so use those folks as an example and a guide to help you inform how to structure your own work. So now I'm going to move to the components of the overall application and then try to talk to some of the major ones. So what you'll see in this slide is there's a lot of components in your overall application. There's the summary abstract, there's a narrative, facilities, resources, budget and justification, bio sketch, research plan, human subjects, etc. And we mostly focus on this, right? We focus on the research plan and the bio sketch section mostly when we're in training sessions and these kinds of things and working with colleagues. But in reality, I can tell you as a reviewer, I look at every single one of those components because they help me guide me and inform me about whether you can successfully succeed in your proposal, whether you have the facilities and the infrastructure and the institutional support to help you do your work, whether your budget is appropriate and you have the appropriate staff and research team to help you successfully accomplish the aims of your project. I also want to know if you're treating your human subjects appropriately, if human subjects are involved. The letters of support and appendices help me gauge and judge whether you have institutional buy-in from community colleagues, from other hospitals, from places where you're going to be recruiting patients. So when I am a reviewer, I look at all of these components, and they're very important in helping me judge and gauge the potential for you to successfully carry out those aims. And while we focus mostly on the research plan and the biosketch sections, I would say every piece needs to be attended to very carefully, with a lot of detail, with a lot of review. And if you can, work with your colleagues and your co-investigators to review all of these parts. Try not to leave some of these pieces to the last minute and not have someone else review them before submitting. My final overview point is to plan ahead. The general R01 deadlines for new submissions are February, June, and October 5th every year. And like I said, I try to do this a year ahead of time if I can, 9 months more realistically because of other things going on. But a lot of these pieces need to be finalized in advance. They count on other infrastructure and support offices within your institution. It's not all about you doing something at the last minute by yourself. You have to rely on staff and other administrators that have a lot on their plates and probably are overbooked and understaffed just like you are. And so keep those things in mind. Part of my 9-month to 1 year mantra is not because of how long it takes me to do the work, but how many levels of approval and review have to occur before something is submitted for that electronic submission. So you need to keep those administrative support team involved. They are really wonderful and helpful. They have experience in helping you submit a grant, but they also need to help a bunch of other people. Yours is not, even though it's really important to you, yours is not the only grant that they're working on. So it's really important to keep that in mind and be considerate of the fact that they have a lot on their plates too. And that the earlier you get started on it and the earlier you get your questions answered, the better prepared you'll be for your submission. Letters from collaborators take time to secure and follow up on and get. Those also take time. Bio sketches take a long time, especially if I'm working with folks who aren't as experienced with research. Sometimes I have to take a CV or something else and turn it into a bio sketch for them because, again, I'm the PI, it's important to me, so I'm going to make sure it's done right. And so those kinds of things take time. And sometimes when you start, you're just working on the science, you don't even realize how much time all these other pieces take. The statement of work, the ancillary documents, but those are really time consuming, almost as much so as the research plan itself. So I would work on those in parallel as you're working on the research plan to ensure that you meet your desired timeline goal. So let's focus now on the research plan components. This is like the meat of the proposal. It includes the specific aims, the significance, the innovation and investigators, your research methods or approach, and the environment. So I'm going to talk about those each sequentially with some examples. But again, a lot of this is a broad overview, and we can get into more details in some of these more specific topics in our spring GMaP meeting. So let's focus on specific aims first. It's frankly the most important page of the proposal, and it sets the stage for the entire research strategy. In a lot of cases, it's the only section that some of the reviewers will read. So you have to think of it as your Shark Tank pitch. So what happens in a review session is you have usually a primary, secondary, and tertiary reviewer who really read your whole grant from start to finish, like I described in the beginning. But then the rest of the review panel, after those first 3 reviewers discuss, the the strengths and weaknesses of your proposal, they can ask questions and they can follow up and there's like a 15-20-minute discussion. And what happens is they will refer to your specific aims to give them an overview, like a summary of the literature and your methods and the research aims. And that's all the pieces they're going to read. And so it really is important to perfect those specific aims before going in and working on the other parts of your proposal. And that's why most people think of it as the, you know, the make or break point of a grant proposal. So in more detail, it's you want to state the goals of your proposed research. You want to summarize the expected outcomes, including the impact on the research field involved. You want to list the specific objectives of the research proposed. For example, is it to test a stated hypothesis? Is it to create a novel design, solve a specific clinical or research problem, challenge a paradigm or clinical practice that currently exists? Or is it to address a barrier to progress in the field? So all of these things are important, and you want to start with that overview and then get into the nitty-gritty of your aims. So some of the common mistakes in the specific aims is if it's poorly focused. If you're just too broad and never kind of specify exactly what you're working on, that's a problem. If it's underdeveloped and doesn't give a good sense of your question and how it fits within the field and how it's going to move the field forward, that's another problem. If your hypotheses aren't clearly articulated and aren't supported by the literature, at least how you summarize the literature, then that's going to be a problem too. And if it's overly ambitious or includes weak aims, that's going to be a mistake. And if your aims are not well integrated, one to the other, that's going to be a problem. And another common mistake is your impact is overstated or not stated at all. So either you don't finish out your aims with talking about the scientific and clinical impact of your research, or if you state like this is going to solve all health problems in the world, that's going to be a little overstated. But I can't tell you how many times I've said that's a huge leap as I'm reviewing a grant, thinking, well, that's a huge leap to make about how this project is going to impact, you know, research or clinical care. So make sure it's not overstated, but not understated either. So some other tips for specific aims: leave readers eager to read the rest of the proposal. Don't make it so vague that they don't understand what's going to be in the proposal, but make a compelling case that they're thinking, wow, this is really important. This is really exciting work. And I want to read the rest of the proposal because they've convinced me that this is an important problem. Write for experts and non-experts. So you can't assume that your whole review panel is going to know even cancer research, because you can have someone like me who does kidney health disparities, but because I'm a methodologist in a particular area, I do quality of life, I do health equity, health services research, I might be called on a review panel for NCI, and I am a scientific expert, but I'm not necessarily a cancer science expert. So you have to make sure you write in a balanced way and that you explain technical terms that only cancer folks may know without excluding scientists who are very smart, who are very skilled, but just don't know your specific area. Again, clarity is key. Reviewers often refer back to the aims page as a table of contents for the whole grant. So make sure everything in your aims kind of is a foreshadowing of your overall grant. So here's an example of an aim. Compare differences in patient level characteristics between unstably housed transgender and unstably housed non-transgender veterans. So so that's the aim, and then we clearly state the hypotheses. Compared to unstably housed non-transgender veterans, unstably housed transgender veterans will be younger, more racially and ethnically diverse, and reside in more likely to reside in urban than rural areas. Additionally, we hypothesize that unstably housed transgender veterans will have more comorbidities than their non-transgender veteran peers. So this is a colleague of mine who works at the VA, who's interested in trans care within the VA healthcare system, and he generously loaned me his aims to use as this idea. So what this is that last part of the specific aims that gets into the aim and these testable hypotheses that are very clearly specified, that would have been preceded by an explanation of the literature and a brief overview of the methods that you were going to use. Then you have the aims, you have your hypotheses, and an impact statement. So then moving on to the research strategy, the key components of your research strategy are the significance, the innovation, and the approach. And within the approach, you also have your research team involved. So for the significance, what you're trying to do is answer the question, why does this need to be done? And that's distinct from innovation, which is how is this work novel and unique? And then your approach is what relevant work have you already accomplished to date, and what methods will you use to accomplish the aim? So really key distinction between the significance and innovation is significance is the impact that something will have on some other thing. And that's why we think of it as a drop in a pool of water. What are the ripple effects? So what is the significance that this will have on the field, on clinical care? And that's distinct from innovation, which is a new and substantively different way of considering or addressing something. So it's that unique little orange swan among gray or black swans in the water. And the idea is what makes this innovative? And reviewers will look at both significance and innovation, are asked to make comments about strengths and weaknesses in both sections and rate them. So for significance, what you want to do is explain the importance of the problem that the project addresses. You want to discuss the rigor of the prior work and demonstrate that you know the literature and can think critically about it. Only include the most relevant literature and preliminary data, and state explicitly what contribution your project will make to science and why that contribution is important. More and more, the significance has to be really succinct and to the point, because folks are, over time, I remember when proposals were 25 pages and then 12, and now they're going down to 6. So over time, the proposals are getting shorter and shorter. And so you have less time for significant or less space for significance because you want to spend more time on that methods and approach section. So the significance flow should be overall the current state of the knowledge, and then knowledge gaps, how the proposed research will fill those gaps, and then a concluding significant statement. And if you want to be really reader-friendly or reviewer-friendly, you need to state it as our project is significant because, and even put it in bold, because reviewers are going to read a lot of these grant proposals. The writing tends to be small and tight, and their eyes get tired like every other human being. So make sure to make your writing as reader-friendly as possible, and putting things in bold, indicating why your research is significant, not forcing them to guess through your subtle writing style, but really just putting it right there, straightforward, really helps reviewers understand your work and understand why it's significant. And it helps them make the case and argue for the importance of funding your work, or the importance of your science in general. So some common mistakes for this section is the need for your study isn't justified, it's too lengthy, it doesn't have focus, and it's just this extraneous information. It shouldn't be like a literature review of everything. It really needs to be tight and succinct and strategic. If key references are omitted, that's a problem. Often people that you're citing are going to be on your review panel, and you don't know who they are at the outset. You don't know which review section your project will go to, but it's really important that if you have key critical references that are out there, that you acknowledge them and you include them in your significance section, and you indicate why your work fills some kind of gap from the research that already exists. And then again, you want to state the significance and importance of your work, but don't overstate it. Again, don't say that you'll solve all medical problems, right? And I'm being sarcastic, but the point here is don't overstate the significance of your work either. And then again, innovation. How does the proposed work substantively depart from the status quo? What makes it unique and different from all the other swans in the water, right? How will the proposed work allow attainment of new currently unattainable horizon? And how does the proposed work demonstrate a new use of an existing tool or method? All of these are different ways that you can make the case for the innovation of your project. And you need to, again, cite some literature, indicate what's missing, and how your work will be that innovative and unique piece. So here's a significance and an innovation checklist. You want to make sure that you can check off all of these things as you go. So my application makes a solid case for my research. It's important, so all my reviewers understand its significance. I balance the amount of information to include with my study section's expertise. I focus on how my project addresses critical research. To show innovation, I describe how my project is new and unique, but not too far out of the box. And then I highlight significance and innovation in other parts of the application, such as the abstract. And again, that's a piece we can get back to if time allows. Moving on to the approach. The approach is what we used to call the methods section, right? So you are talking in the approach, you talk about what you are doing, how you're going to do it, what you expect to find, what you will do with unexpected findings or mishaps, because you need to keep those, the likelihood of those in mind. Reviewers want to see that you've thought through that and how you're going to address those things. And you want to include details of preliminary work that inform or support your research. So I like to think of the approach as really three to four sections, right? You have the preliminary work, you describe the expertise of your research team, and then you talk about your methods and your analysis. So first, the overall structure. You want to give an overview of your approach. You want to describe your approach for each aim, whether it's aim 1, 2, or 3. You can either talk about your approach separately for each aim, or if the approach is overall the same and you're going to answer questions for 3 different aims, then you only add new details as needed for approaches that are different from aim 1 to aim 2 to aim 3. You want to include a study timeline, and you also want to include implications for future directions. So here's an example of an overview. The proposed investigation will be conducted in 2 phases. In phase 1, we'll conduct a retrospective cohort study using the institution's extensive and detailed electronic medical record to determine the readmission rates after hip and knee replacement surgery. Second, to thromboembolic complications. In phase 2, a pre-post intervention design will be used to assess the impact of a post-surgical thrombosis prophylaxis program on baseline thromboembolic complication rates. So this is just the overview section, but what you're doing here is giving your reader, your reviewer, the overall picture of what you're going to do in your study, and then you talk about those details. Here's some essential details that you need. You're going to need your design, your study sites, your study population and sample characteristics, your recruitment, follow-up, and data acquisition. You're going to describe your intervention if you have one, staff training procedures if specific training is required, or if the training already exists, you're going to describe what the staff needs to be able to do or be certified to do. You're going to describe your randomization method, your data collection approach, any caveats, data management and missing data, statistical analysis and power and interpretation. And I add the asterisk there because what you need to think about is, do you need to do this once for all 3 aims, or is it detail that you want to separate out by aims? So sometimes it's presented in one subsection for all aims, and sometimes it's separate. And that, again, that depends on your specific methods. So when you talk about study population and recruitment, you want to describe and justify your inclusion and exclusion criteria, how you identify and recruit participants, and how do you know your methods are feasible and will be successful. So some of that is garnered by your preliminary work section. Some of that is garnered by how many people come through the clinic that you may potentially recruit, but you need to make sure that you make the case to reviewers to convince them that this is the right number, you have access to them, and you have the experience, or someone on your team has the experience to be able to recruit successfully at a strong recruitment rate. Then the intervention, you want to provide sufficient detail so others can replicate your methods. So you need to talk about the doses or the intervals of the study, the diagnostic test with the intervals that will be used. What is the control group and what will they experience? Standard care or a particular protocol, even for your control group, if there is one. If there isn't a control group, you need to justify why. Again, staff training, it's often required for chart reviewers and interviewers. It should describe a method of assessing competence in your staff and should describe a method for error checking if you have several staff members working on your project together. Randomization methods, how and when will the investigator assign patients to treatment group or participants to treatment group, your rationale for the randomization, and are you randomizing patients or are you randomizing sites or by providers, and the justification for doing so. And then the criteria required to break randomization. Is there going to be at some point where you do an interim analysis where you realize the intervention is not really good for patients and you're going to break the randomization? Or is it that it's so good and keeping people in control is actually keeping them from a treatment that really needs to benefit everyone, and then you're going to break the randomization for those reasons? In any case, folks are going to look for those things when they're reviewing your grant, so you need to make sure that you've convinced them that you've thought through these things and that you have the methods and approach necessary to do that. Data collection. Are you doing interviews? Are you doing blood samples or other kinds of biosamples? So in this case, what you need to do is describe the data collection procedures and the quality assurance measures that you're going to take into account. You want to make sure you use standardized and validated measures, provide details on reliability and the validity of those measures, and define and justify primary and secondary endpoints. And also, something that I find useful, because I use a lot of quantitative standardized measures, is I give a table of all the measures I'm using and the different time, because I do longitudinal studies, I do the different time points that I'm collecting each of the measures that I'm collecting, so that my reviewer can have a summary of, here's the data I'm collecting. I describe it in all this detail, but this table really summarizes, here's what I'm collecting at time 1, here's what I'm collecting at time 2, and here's what I'm collecting at time 3. Sometimes it's a repeated measure, so I'm collecting them at all 3 time points, and sometimes it's just pre-post, so it's just time 1 and 3. But whatever it is, a table, if you have a lot of measures, can help summarize things in a very clear way to make it easier for the reviewer to follow what you're doing. What about analysis? That's an important section too. You need to talk about data management in terms of how you're going to acquire the data, how you're going to code, store, and manipulate the data. You need to address data safety and security. And then you need a detailed analysis plan where you restate each aim and hypothesis and how your analysis will test each one of those. Again, I like to do an analysis plan for each aim, but sometimes that's not necessary. Sometimes all 3 aims can have a follow-up analysis plan. And sometimes if you're doing what I do, I have a quantitative aim, a qualitative aim, and then I have a cost effectiveness aim and an implementation aim. Then what I do is summarize my aim and then the different types of research methods I'm using and the different types of analyses that I'm doing to to analyze each of those aims. Sorry, analyze the data for each of those aims. And then you actually have to get into interpretation, how you will interpret the results for each aim. What do the possible outcomes mean for your grant or your knowledge in general? And how do the results for each aim relate to one another? So it's not enough to just say how you're going to analyze it, but you also need to say what results you are expecting to find that will either support your hypothesis or refute your hypothesis. And then, of course, how are you going to address the limitations, describe what can go wrong and your backup plans. What if you have recruitment issues? What if you have unexpected outcome rates? And in your analysis plan, you need to address things like confounders and biases. And like I mentioned before, interim analyses, null versus an alternative hypothesis, and alternative strategies for important hypotheses. What if you don't recruit enough people? Are you not going to be able to test your hypotheses at all? Or are you going to be able to make some other conclusions if you think about alternate analyses plans to at least do the best you can with the data that you did collect? You also need to think about implications for the future. That's so what, right? That's really important for reviewers because with NIH funding, they want to know what you're going to do to benefit the health of the United States. So what are the expected impact of the research project? What it means for the disease process in general, or how can it be used either now, like once your study's completed, or for future research. It's not enough just to say we're going to gain this knowledge that policymakers can use. You need to explain in very specific detail how the results of your study can be used by policymakers, scientists, clinicians. And then you also need to think about what are future research and practice implications. So describe a path regarding how the results from the aims that you accomplish will help structure future research, discuss the implication of results for clinical or health services interventions and changes to clinical care, and discuss the sustainability of your results beyond the study. A lot of reviewers nowadays are asking, yes, you can do this kind of intervention as long as you have research funding, but how can you sustain the effects of your health services or clinical intervention once the research dollars are gone? So you need to think about what would be next steps or what you would need to do to support the case that the intervention can be used by hospitals, healthcare facilities, providers, or community groups going forward. This is an example of a study timeline. Obviously, you can see across the top here, I just used the same year and quarter, but what you want to do really is, describe each fiscal year and what you're going to do in quarter 1, 2, 3, and 4, and so on, and then by months. And this is like, an example of things you would want to do. You would establish a data use agreement, stakeholder engagement, pilot and refine interview guidelines or summary template, conduct and transcribe and analyze interviews. And you need to give very detailed information about how you're going to carry out your project. Again, the reviewers need to know that you've thought through this very carefully and that you've planned this out. And they also need to see that you can accomplish your goals within the timeline of the study. Because if you're not going to get results for another 10 years, it's not going to be feasible within a 5-year funded project. So it's very important to keep all of those things in mind as you go about describing your study and demonstrating again to reviewers that you've thought this through and it's feasible. So some approach tips: begin with an overview, make it clear how each specific aim will be accomplished, justify everything, especially if there is another option. So justify your choice of one method over another. Make sure you anticipate and address questions by the readers or the reviewers that they may have. Make sure you're very honest about potential weaknesses and how you're going to address those weaknesses and what's going to happen. Offer alternative methods and contingency plans in case your primary method fails. Some common mistakes in the approach section is failing to provide a method for an aim, maybe potentially major design flaws, imprecise measures, not enough details in your analysis plan, or insufficient statistical power. That it's not clear that you can recruit the needed population, or that your power calculations are not based on your primary outcome or are really unrealistic. So those are things, and the reviewers are experienced researchers themselves. So these are things that befall them. And so they're going to make sure to look that in your proposal, you described what you would do and how you would address these kinds of issues that they've experienced themselves. So I'm gonna stop sharing just for a minute, take a little pause. Are there any questions before I get into the other parts of the grant? Because I went through that really quickly. Those are the components of the grant. And then I'm going to go on to like BioSketch and other ancillary documents. Are there any questions right now? And would this be a good time to do a little bio break? Is that okay? Amy, Emily, is that okay? Okay.
Yeah, I think that's a great idea.
Okay, so I'm going to do like a 5-minute bio break. It's 2:07 right now, so 5 minutes will bring us to 2:12. So I'm going to turn off my camera, pause for a minute, and then I'll come back and talk about the rest of the grant section. Thanks. Hi there. We're back. It's 2:12. I did want to put in a shout out to one of my former colleagues at the University of Pittsburgh, Dr. Leslie Hausman. She and I developed a lot of this work and slides together as we were teaching specifically research, design, and development and healthcare equity research. And so I wanted to thank her for sharing her slides with me over the years, and definitely put a plug in for her on the East Coast for the great health equity research that she does, and then other colleagues that I've worked with among the years at Pitt and UNM. I'm going to go back to sharing my screen, and I'm going to now move on to the NIH BioSketch. So the BioSketch you can think about as your research resume. Many of you are familiar with it already. And what I've noticed in the last 5 years is that the format has been changing at an increased pace than it did before. So do always look for new formats. The newest one that I've seen is as of January 25th, but new formats keep coming out and the versions change frequently. And it's important that you personalize each section for every grant as you go. Because, for instance, I, as a reviewer, will look at the BioSketch of the whole research team to determine if they have the right team members to accomplish the aims of the proposal. If I don't see the appropriate experience for each of the things that they propose in the aims, I will doubt that they will be able to accomplish those aims because I won't see a particular person with a particular set of expertise to help the research team accomplish the aims. And what's really important that I've learned over the years is if mentors or co-investigators give you a generic one, as the PI, it's in your best interest to personalize it for them. So don't expect them to do it for you. You're the one that's on the clock. It's your name, you're the PI. So if they don't have the time to personalize it, then ask them if it's okay if you personalize it for them based on the aims of your proposal, and do make sure that they approve, they review and approve what you did and the changes you made before you submit it. That's a professional courtesy that I think is very important. So now in terms of where you can get some ideas for the BioSketch, this is the overall structure. I'm going to go through this pretty quickly because I'm happy to share a PDF of my slides after we're done, but make sure that you focus on the important sections. The current one, as I said, has been revised quite a bit. It's approved through 2024, but I think a new one, if I don't have the right BioSketch here, a new one is forthcoming. So the key things to remember, and I see people kind of missing this out all the time, is that the contributions to science is 5 max with 4 publications each. What I've seen people do is accidentally switch that and have 5 publications within 1 contribution to science. And they do pay attention to those things, and they do number those, they do check on those numbering, and you wouldn't want your grant kind of disqualified or thrown out because of like an administrative error like that. So do be careful about that. And remember to also add your My Bibliography link. And here's some useful websites for helping you develop and design the BioSketch. I'm going to make sure that you guys look at those to help you develop the My Bibliography. And there's these websites didn't exist when I was first developing my BioSketch, but I think they're very helpful and handy. If you don't have one yet, you can use these tools to help turn a CV into a BioSketch with minimal work on your part. But there's still some thinking involved, certainly in the personal statement, and certainly when you're summarizing your contributions to science. So do take a look at these different websites. And I even have a couple of YouTube links here that kind of walk you step by step of the process and how to do it. And as I mentioned in the beginning, the environment and institutional commitment is really important. That's the facilities and resources page. Make sure you personalize it for each grant. There's nothing that I hate more as a reviewer than reading a grant with an outdated facilities and resources page where they refer to someone who's the PI who's really not the PI on the proposal, or they have all this irrelevant detail where you can see someone just took a template and threw it in there and didn't even pay attention. And it makes me question the buy-in from that team or from that collaborator, as well as it makes me wonder whether they really do have the facilities and resources that they need. Don't assume just because you come from this awesome, outstanding center of excellence that every reviewer is going to know that reputation and just give you the benefit of the doubt. Make it very clear to everyone, whether they know your area or not, that you have the appropriate facilities and resources to accomplish the aims of your proposal. So that means having a clear description of the institution's environment and making sure that the description supports all the aims that you propose in your project. Another part of this is the support letters. I can tell you, I was just on a review panel that was very important. It had to do, well, I can't tell you the details of it because it's like Vegas. What happens in a review panel stays in the review panel. But needless to say, we needed to know that the research team had buy-in from certain community members, and they didn't have a single letter of support from any community member group saying, yes, we reviewed this proposal, we helped work on it with them, these ideas are important to our community, and we promise to support them and give them access to our community members and to patients in our community. When I don't see that there, I wonder if they're going to have to do all that work after they get funded. And if they have to do all that work after they get funded, for those of you who have worked with community groups, you know that can take a year or two. And if it's a year or two of a 5-year project, then they'll never be able to accomplish their aims in time unless it's specifically part of their timeline. So if I don't see those letters of support, my first thought is, my God, they're going to spend a year or two just kind of getting those relationships in place and getting support for that. They really should have done it already. And that's going to be a big strike against them, especially for those of you who have worked with community groups. You know how much work that takes. You know how much time that takes. And if they don't have that calculated into their timeline, then you have to wonder whether they're going to be able to accomplish their aims within the time frame of the proposal. Human subjects documentation is very lengthy, and over time those components of the NIH submission have gotten more complex. It used to be you can just submit it as one continuous document as part of your proposal, but now there's like boxes you need to fill in, tables you need to have, some things you can copy and paste, some things you need to hand enter on assist. And so it's really important that you organize all of these things, that you organize the data safety monitoring plan, how you're going to ensure women and minorities are recruited. Individuals across the lifespan means that you have representation from younger and older population. And if you're not, you have to justify scientifically why you're not having representation across the lifespan. You need to talk about your recruitment and retention plan and your dissemination plan. These are all now separate components of the human subjects documentation that take thinking and time, that is separate from what's in your actual research plan and proposal. So keep those parts in mind. This is very lengthy, and I apologize for this. And this is like a big no-no in slide presentations. I know this font is small. The appendices have been restricted over time, again, by NIH and HRSA and HRQ. So you need to be careful that you don't include any kind of extra data, any compilation, lists of variables or acronyms or analyses plans or any of that. Do not include that in the appendices or your grant will be thrown out. Instead, the appendix can only include blank data collection forms. And I can tell you, I found this out the hard way. I'd say about 10, 12 years ago. This was when I was still at the University of Pittsburgh. We were working so hard on a grant to AHRQ. This appendices rule had just come into play, and this was a one-time RFA that was available once, you submit it once, and there was no recurring deadline. And we had one extra kind of model or figure that we thought was allowable in the appendices. Our grant was administratively withdrawn. We didn't even get a chance to fix it, and we were out of the running before we even got reviewed. And it was so painful because we spent so much time working on this grant proposal and didn't know we messed up. But I don't want you guys to suffer that same kind of pain. So be very careful about what you include in the appendices, and don't make this the reason why your grant gets thrown out and never reviewed, because they will be that stringent about it. I've already talked about ancillary documents and the amount of time that they're required. Please keep those in mind when you're thinking about your submission. Even though you have a study timeline that's part of the grant proposal, they now want it as a separate document as well. We talked about resources and facilities, and I think in the spring we'll talk more about the abstract and summary details. These are all important ancillary documents that will take a long time to produce. So you do want to think of about those and make sure you get those done. You also want to make sure to think about your budget and justification. Your reviewers will look at, the key personnel that are involved in your project and your justification for including them. They'll also look to see, do you have enough staff listed and planned and budgeted for to help you successfully recruit your participants and achieve all the aims of your project? Do you have the lab supplies and equipment that you need? Are you thinking about phone and data plans that you might have to fund for your more vulnerable, lower income patient population? Do you need support in terms of like buying paper, folders, envelope stamps? All those things can be in your budget, and you need to think about those. Participant payments, like payment cards and replacement cards, of a replacement cost of those payment cards. Those are all going to eat away at your budget really quickly. But in order to successfully accomplish your aims, participant payments are a very standard expense that reviewers will expect to see in your grant. You can also ask for things like travel costs and publication costs. These are all acceptable dollars to ask for, and as long as you justify them. Sounds like someone didn't mute their microphone. Can you please make sure you mute yourself? Thanks. Okay. Also keep in mind, if you are doing a multi-site study, you're going to have to do sub-awards. So you need, that includes co-investigators from other institutions. You're going to need to secure a statement of work, a budget, and justification from those folks. If you're doing multi-site recruitment, you need to describe how you're recruiting patients at each site. You're going to need to describe how many patients come through clinics at the different sites or come through the community at those different sites. And you're going to need letters of support and endorsement from those different sites. I kind of hinted at this already. The administrative steps are lengthy. They're as lengthy as the scientific portion of your study. So make sure you keep those things in mind as you develop your overall grant. So some final thoughts on grant submission, and I'm running through this really quickly because I really want to make sure that we have time for your questions. Timelines vary by institutions. Some institutions that have a large volume of grants with every cycle need a 2 to 1 month lead time to get all of your documentation to submit it to NIH. I've seen it all. I've seen some institutions that will happily accept things at the last minute, like 2 days before the due date or even on the due date, and other institutions that will simply say, sorry, we can't submit your grant for you because you're way past the deadline. You need to find out what they are. If you have sub-awards or if you're a multi-site project, you need to know what those are at other sites. Make sure you know about internal grant submission deadlines from your sponsor projects office, and make sure that your pre-award administrative person has the contact information of the other site's pre-award administrative person, and that they're communicating early and often so that they know with each other, like which documents are missing, which still needs to be done, so that they can all help you successfully submit your grant. Ultimately, you're the PI. It's up to you to check everything, make sure every I is dotted, make sure every T is crossed. It reflects on you, and any error that's in there reflects on you, and you're going to suffer the consequences if there's an error that you didn't review and didn't fix. So make sure that you communicate with all the sites, that you review things at the, up until the last minute, up until your sponsor project office clicks submit, so that you can have a perfect or as perfect of a grant as you can before submitting it. This is a useful book that folks like to use when we have grant writing workshops. We sometimes recommend that folks buy this book. It's a workbook that's available at this website that I have listed here. I think it's a really great writer's workbook, like a step-by-step guide. If that's something that you need or you find useful, this is the one that we often use in other grant writing workshops. And with that, I can finally ask if there's any questions or if we want to have some discussion, and I'll stop the screen share at this point. So I don't see any questions now. Thank you so much for listening. I'm sorry I sped through it at the end there. Are there any questions I can answer for folks?
I have a small question.
Yes.
First of all, thank you so much for such an amazing talk. These are a lot of really great information. Thank you so much for putting everything together. Regarding the biosketch, so now you said that we have to show the papers that somehow support our proposal, right? What if some of these papers are under review? There's this work that I've already done, and right now the paper is under review. What do you think?
That's really important. So you can put under review papers in the first section in your personal statement as work that demonstrates what you're doing. However, contributions to science are just that. They have to be ones that are already published or in press, that have peer reviewed. And that's really critical, because you can't consider it a contribution to science if it's not out there. But you can include it in that first personal statement section, where you itemize some specific works that may not be that may not even be manuscripts. They may be a website or some kind of other training or some kind of position paper. And that can be described in that personal statement in that first section.
Thank you so much.
Mm-hmm.
I see one question in the chat that says, so do you recommend to write first an R, then an R21, or R01, then an R21?
Well, I always say to write for the kind of project that will answer your research question. So if I would not write an R01 if you don't have any preliminary data or feasibility data to support the work you propose. Reviewers are very critical and judgmental. R01, you need to basically show that you can accomplish all the work, all that's between you and results are the funding, right? So you definitely need to have a lot of preliminary work to demonstrate that you can accomplish each component of your project. And so if you don't have that, I would not spend my time writing an R01 unless you can say we have preliminary work from this similar area, or we've recruited patients in these other cities and we feel like we can recruit them here as well. So that would be the distinction between an R01 and R21. An R21 is where you is a smaller scale, smaller budget to allow you to collect that preliminary data that you will need for an R01. And it's interesting that you say that, Gabriel, that you submitted an R21, but they seem harder to get. Different institutions have different funding practices. Unfortunately, I'm sorry, I'm not as familiar with NCI and what they endorse and support, but that is a perfect question to ask a program officer, actually, because you're right. Different institutions may look more favorably on R21s than others, but there, have faith. There's other sources of pilot funding. I know most of the comprehensive cancer centers have a lot of their own internal pilot funding, and you can get very far with feasibility and pilot funding efforts, even if an R21 wasn't successful? Do I recommend resubmitting? I guess that would depend on your score and the feedback that you got. And I would also, again, once you've gotten the reviewer comments and the feedback and taken some time to process it, I would reach out to the program officer and ask them. So it has a lot. So, and I would say sometimes, Gabriel, unfortunately, scores don't always reflect the feedback. Sometimes what I see is really great feedback with limited mention of weaknesses, but then a pretty bad score, or then a really good score, but with all this detailed comments and weaknesses. And so it's a real challenge to gauge between score and reviewer comments. I would say definitely review the reviewer comments, review it with your co-investigators, follow up with the program officer. You had a lot of comments about the budget. Well then, without knowing specifically what was mentioned, I would definitely reach out to the program officer, because frankly, I've gotten advice like this from NIDDK, where I was like, if you need to go beyond the budget limit, you have to request it 6 weeks ahead of time from the program officer, and there's formal paperwork you have to submit. And my program officer had a really honest one-on-one conversation with me about that, where he said, well, you can submit it, but I can tell you, you're probably not going to get it because we don't have enough money to go beyond the budget. And what you really should do is find matching support or other support to get you lower within, the budget limitations. And we took that information to heart. We found other forms of support, and we added a letter of support from those other funders that didn't put them on the hook for the money no matter what, but they said, we believe in this work. We think it's really important. And in fact, we're so convinced that it's important, if approved by peer review, we will match the expenses, up to a certain amount of money, because that's how much we believe in this work. And frankly, the program officer said that would actually convince reviewers that would be one of the pieces of evidence that reviewers would use to say, oh, this is really important work, and oh, other external institutions are investing in it, and give them more faith in the team or in the proposal and things like that. So a letter of support or a matching letter is really important. And if you don't have enough preliminary data, but if that's the only thing that's standing between you and getting an R21 award, I would pursue that, and I would definitely revise and resubmit. Yeah, the worst they can do is say no, right? Thank you so much. Thank you for these warm fuzzies. I really appreciate it. I always feel like I've had a lot of wins, but I've had a lot more no's and losses. And what I think is those losses, those learning experience are what makes me a stronger investigator and makes my grant stronger. But I also want to take those losses and turn them into education and things that I share with others, so that even the losses are really wins, because our institution and our colleagues can learn from my learning experience, my mistakes, and turn them into wins for themselves too. So I really appreciate you guys being here and your time and your questions. And then again, feel free to email me if you have any questions. I'm happy to answer them offline as well.
So I would like to take a moment here to thank you from NCI. I was really blown away by your presentation, the captivating presentation, and with both content and context. It was really gripping because I could say that it was not the conventional, your boring grandma's technical assistance workshop, grant writing workshop. So this was phenomenal presentation. And thank you so very much for sharing pearls of wisdom with all these future cancer researchers. And I wanted to thank you from NCI, from Center to Reduce Cancer Health Disparities, for this wonderful service.
Thank you. Thank you very much. Thanks, everyone. Have a great afternoon and evening.